Hello, hello, hello. Welcome in. Just waiting on a few folks to show up. Hope everybody's having a good Friday. Just wanted to come on for a few minutes just to tell my story. I know some of my videos or shorts have alluded to it. If you've seen me in any chats, you may have caught on to some of it. But I just wanted to put it out there in case anyone is helped by it or inspired by it or is going through the same thing, to know that you're not alone. So I will start with back in 2010. I was working, single mom, had a home, vehicles. I was doing my thing, living a good life. And then I started having pain that felt like contractions. If you ever had been through labor, you know what I mean. It felt like contractions. So you know when things just don't feel right and you need to take care of it. So I called my doctor and told them about it. And they were at lunch, so they advised me to go to the emergency room. Now, mind you, I live in the country, and the nearest emergency room is probably about 35 minutes away. So headed to the emergency room and was assessed and just told them that I had this terrible, welcome in, told them that I had this terrible pain in my stomach. And they, did some testing and barium swallows and all this fun stuff and released me. And I'm like, I cannot go home with this pain. And they were very nonchalant about it and just like, well, we're not here to diagnose you. So the next day I went in. I think they gave me something for pain because the next day I woke up and I was in even more pain. Welcome in, everyone. Thanks for being here. I'm just telling my story. So I was in even more pain. And my son and his girlfriend, excuse me, took me to the emergency room, back to the emergency room. And my son's girlfriend was very vocal about them releasing me the day before with all the pain that I was having. And so they did x-rays and all this stuff and saw that I had a blockage. And I was 41. And they were like, oh, well, you have a blockage, but we don't think it's cancer. There's no way you can have cancer. You're too young to have cancer, da 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 da. So the next thing I know, I am being admitted into the hospital and have even more tests done. I'm severely anemic. And I met with the surgeon. They did first they did a colonoscopy, and which was horrible. And they came back and said that there was a blockage in there and they could only go so far in my colon. Welcome in. Thank you for being here. And so they were able to biopsy it. And then the surgeon came in and said, you have this blockage. Do you want us to take it out or do you want to wait? I'm like, well, of course I want you to take it out. I mean, it's obviously what brought me in here was the pain and because of the blockage. So they scheduled me for surgery the next day. So I ended up having a golf ball sized tumor in my large intestines, right at the hepatic flexure, which is right underneath my liver. And so they decided to take that out and then also take out some lymph nodes, which I think of 7 of them, 2 of them ended up being cancerous. Thanks for coming in. Glad you're here. So at 41, I was diagnosed with stage 3 colon cancer. I was fortunate that I didn't have to have a bag, but I did have some scars and, they cut my stomach open. So then I was in the hospital for 7 days. They kept giving me blood, giving me iron, trying to get my iron up. And then I met with the oncologist. Thank you for coming in. I appreciate it. I'm just telling my story and hoping to be an inspiration to someone, or maybe someone can relate. So I ended up being meeting with the oncologist, who gave me the option, explained to me, oh, it's just a fluke. You're too young to have this. Stage 3 because it had gone into some lymph nodes. It's right under your liver. We think we got it all, but if you want to do chemo, it's, advisable. So, of course, I decide I'm not going to half-ass this. I'm not going to take the chance of it coming back. So I'm going to go ahead and do the chemo. So I did 8 rounds of chemotherapy, which was brutal, very, very brutal. If anyone has gone through chemo, bless you. I understand the struggle. Thanks, guys, for coming in. I appreciate you being here. So the chemo was 2 weeks of an oral pill, and then I had a port, and then on the 3rd week, I would have an infusion of a drug called oxyplatin. And that drug just knocked me for a loop. I was not able to function. I was not able to drive. It's a neurotoxin, which means it kills off the nerves in your body. So anything cold, anything room temperature, like a soda can or a doorknob, it was like touching dry ice. It was just horrible. And then that wore off about a week later. And then during that week, I had like a rest period. So I had 2 weeks of oral medication. The 3rd week, I had infusion. The 4th week, I was free to do of drugs. I didn't have anything then. And then I'd start back the cycle again. And I did that for 8.5, 9 months. So when that was done, well, mind you, during this time, I was unable to work. I was, like I said, 41, and I had an 8-year-old son who lived with me, and then 2 grown children who, had families of their own, who lived close by, but not with me. So taking care of an 8-year-old son and trying to explain to him what I was going through and why I was going through why I couldn't do this, and, struggling to make his life as normal as possible, taking him to the baseball games and, taking him to school was a struggle, and everything was just horrible. But I did it. But after you go through something like that, it puts you into a new perspective where you realize what's important and what's not important. And you hear the saying, don't sweat the small stuff. Well, that's kind of where I was. I didn't let things bother me. I knew that how precious life is and how close to being out of this world, taken from this world, I was. I didn't realize it at the time, but I quickly realized it afterwards. And I had a grandchild on the way, so I was just fighting, going through the chemo, hoping that my body was healing for my children and my grandchildren. and just learning to laugh the small stuff off, because in the grand scheme of things, it doesn't matter. There's things that just we make into issues that just don't matter. So during that process, I ended up losing everything, my home, my job. I wasn't able to work. I wasn't able to um, care for myself. My mother came through and paid my living expenses and things like that. Ended up having to sell everything. And what I didn't sell or give away, I packed up into my van and headed south to stay with my mother. Thanks for coming in, guys. I appreciate it. So I continued going through everything. I had finished the chemo and everything, had finished going through that, and moved south with my son to stay with my mother. Um, Ended up getting a job, going back to work, getting my own apartment. Getting everything was good. Everything was going great. I did have to follow up with CTs every 6 months, lab work every 6 months. And at one time, I had pain in my hip. And I expressed to them that, ever since I finished the chemo, that I've had this pain in my hip. And I think they x-rayed it and, just kind of brushed it off as being, just the toxins or the drugs leaving my system. So after a few years, I think 5, 6 years, I go in for a routine mammogram, and then I get the call back. We need to do something else. We think we see something. So I went in, I think for an ultrasound, and then they said they had to do a biopsy, and I just lost it. It was just like deja vu. Everything that I went through the first time, I just totally lost it. So ended up having breast cancer and was given option of lumpectomy or a mastectomy. And after doing some crying, and I didn't want to do a whole lot of research because I knew that Google would just have me in a tizzy, so I wasn't going to do that. I had friends, advising me, and ended up deciding that I would have a double mastectomy because I wasn't going to take the chance of, this was my second cancer in 5 years. I was not going to take the chance of just doing a lumpectomy and then it coming back, or doing just one breast and it coming back. Thanks for coming in. I'm just giving my story, giving my little inspiration, hopefully inspire someone to get checked. So I ended up having the mastectomy, which is a brutal, brutal, brutal surgery. I don't care what anybody says. It is brutal. The pain is undescribable. And not to mention the mental and emotional effects it has on you. I was lucky in the aspect that my son, who was now, 12, I guess, was able to spend the summer with his older brother, my other son, so he didn't know anything about it. And when he came home for the summer and I was still recovering, I couldn't tell him what was happening. My son and I are very, very close. He's my baby. I've been single ever since the day he was born. with him. His father's just not in the picture and now is deceased. But anyway, that's another story. But my son, I just could not tell him what was going on. So I ended up having the double mastectomy, reconstruction surgery. I had some complications with the implants. I had some complications with the expanders. It was just brutal, brutal, brutal. And then I was put on a drug, kind of like a preventive drug. I don't want to say the name of it, but it's a very common drug that they give to breast cancer patients that I was on for 6 years. So let me just back it up a little bit. Prior to the breast cancer diagnosis, I was having neck pain. Felt like a pinched nerve in my neck. So I went to my doctor and they did x-ray and CT and everything. And she said, your neck just looks awful. Your neck looks like the person twice your age. And then she sent me to a specialist who did some more tests and was very nonchalant about it and just said, you need to lose some weight. I was like, okay. So then after my mastectomy, so I did have injections and everything in it. And then after, the breast cancer diagnosis, I had to kind of put my neck on the back burner. But then you fast forward to now. I had terrible, terrible back pain. I did physical therapy. This is my lumbar. Physical therapy, had injections, muscle spasms that caused me to fall and break my wrist, break my ankle. And these are 2 separate occasions, and I'm just like, I can't keep doing this. Something has to give. I ended up having surgery, weight loss surgery, and lost 100 pounds. And was still having problems with my neck and my back. My neck started to get to the point where it would wake me up, it would burn, it would hurt. And I'm not a wuss when it comes to pain. And this whole time I'm in all this pain and all this muscle spasms and weakness and not able to move the way I want or do the things I want. I'm still trying to keep a positive attitude for my children, still trying to maintain a laughing heart, as you so to say, where, you get through this, try to find the humor in things, try to find the best of silver lining, I guess it is. I don't know. So anyway, my neck got to the point where I couldn't stand it anymore. So I went back to the doctor and they did some tests. And there's a test that they can do where they like hold your finger and flick your fingertip, and if your thumb reacts, then it's an indication of spinal cord injury or spinal cord damage or compression. So the doctor did that and then sent me for MRI and gave me a surgery consult. So I did the MRI, went to the surgeon, and indeed I did have spinal cord compression, which was causing the nerves in my arm to not function the way they're supposed to, just causing a lot of issues. So they decided the surgery was the best thing. So I had a ACDF, which is the surgery where they go in through your neck, and he decompressed. I had some bone spurs, so he decompressed, which means took the bone or the disc off of my spinal cord and fused 3, 4, and 5, I believe it was. So everything was good. Everything was great. Then I got another injection in my back, got an injection in my hip. I was feeling good. Life was good until it wasn't. So I went back. That was in February of 2024. So I went back in October of 2024 and for a follow-up, and I'm like, I I feel worse than I did before the surgery. I can't function. I can't get out of bed. I can't raise my head off a pillow. I'm dropping everything. I can't lift my arms up. I can't hardly hold a pen to type or write. And it was just something had to happen. So they did another CT, another MRI, and decided there's still some compression in there, and it's a little bit more than what they expected. So I decided that another surgery was needed. So I went in February of this year to have another surgery, and this was the posterior, which is the back of my neck. So they went in through the back of my neck and fused together 3, 4, 5, 6. And usually when they do that, it immediately or almost immediately relieves the pressure off the nerves and pressure off your spine, so you don't have the tingling and the burning and all that stuff. Well, that didn't really happen for me. I did physical therapy, and I'm, good friends with my physical therapist, and we worked together, and I would shake and almost fall, and she was like, we can't do this. Something's going on. So I had some tests done, labs, things like that, to make sure there wasn't any kind of like rheumatoid arthritis or autoimmune or anything like that. And thank you guys for sticking with me. I just wanted to get my story out there, hopefully to let people know where I'm coming from, my journey, hope to inspire others, maybe inform others, and just give a perspective on why it's important to laugh. So I went back to the doctor in July of this year for, routine checkup, or not a routine checkup, just a follow-up. And they always do an x-ray to make sure the hardware and everything's in place. And the doctor saw me walking down the hall, and I guess he could tell by the look on my face that I wasn't good, because he asked me, what's going on? And I just started tearing up and said, I just am so frustrated because I'm doing everything I was asked to do. The burning and everything in my feet, I could hardly walk. The burning in my legs, the burning in my arms, the pins and needles in my arms, the not being able to lift my arm up to shower, wash my hair, not being able to put dishes away, not being able to bend over to tie my shoes. I'm like, it's just, I don't understand what's going on, why we're not fixing this. So he decided he was going to send me for another nerve study and another MRI, and suspected that it was adjacent segment disorder, which is where your disc and vertebrae above and below the fusion start breaking down. So I had the MRI, and they wanted to wait until after I had the nerve study, but I was, 2 weeks out from having the nerve study, and I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, 2 weeks out from having the MRI. And I was, very vocal about, no, I'm not waiting that long. If you need to do a surgery, you need to do it now. I'm not waiting until next year or until after I do a nerve study. I'm not living like this. I was to the point where I could not even get out of bed. And so they did decide that it is the adjacent segment disorder. There is more compression at 4, 5, and 6. And they're going to do another surgery. So I am scheduled for surgery for November 10th of this year. They're going to go from C3 to T1. They're going to fuse it. They're going to put plates and screws in. And then they're going to have plastic surgery come in to close up the incision. The last time I had the neck surgery in the back of my neck, I had 21 staples. I can only imagine what this surgery is going to be. Anyway, after doing some research and just trying to figure out why all of this is happening, and I'm not looking for pity. I'm not looking for anyone to feel sorry for me. I'm not any of that. I have done my research. I have met with a disability doctor and told him, my history. And he asked me what chemo drug I was on. And I told him the only one I could remember was the oxypalatin and the 5-FU. And he said that oxypalatin, which is the drug that I had infusioned, is known to have this side effect long term. So in other words, the chemo drug that I have for my colon cancer, which I said is a neurotoxin, which kills the nerves, and as chemo does, it kills, all the cells in your body. It also breaks down bone. So it was given to me in such a high dose that it has destroyed my bone. Thanks for coming in. I appreciate it. So that chemo drug is partially responsible for the condition I'm in now. And it sucks. However, life goes on. There's still things to be grateful for, things to be happy about. I now have 5 grandchildren, all girls, that I live every day for. There's always something that you can find to laugh about or just to find joy in. And like I said, I'm not looking for sorrow, pity, anything like that. If I can be an inspiration to anybody, anyone needs to get more information before making decisions of treatment. One thing I will say is you really need to advocate for yourself. Just because the doctor says, well, this is what you need to do, research it, advocate for yourself. You know your body better than anybody. If you don't agree with what they're telling you and you think, don't go to Dr. Google. Don't Google it. There's other good resources out there. But just talk to your doctor and try to determine why they came to the conclusion they did or why they recommend the treatment they do. Ask the long-term effects of it. I don't know that I could have done anything differently. It's just, it is what it is. Um, but yeah, it puts things into perspective. It makes you realize what really is important, what isn't important, things that you should worry about, you shouldn't worry about. Um, just know that everything's going to work out. It may not work out in your time or the way you want it to, but it's always usually works out the way it's supposed to. Um, Again, I have my third surgery in November 10th. Um, I have, as I said, I've been to the disability doctor. I've filed for disability. Of course, it was denied, and now it's in the appeal process, so I'm waiting for that. Um, I had a really, really, really good job. I was able to use my PTO time, had long-term disability that I was able to take up until August, and then that ended, and then the long-term disability, of course, that was denied, so I'm in the appeal process of that. But I'll get there. It'll happen. We'll get it there. Um, Thanks for coming in, guys. If you don't mind, just leave me a little comment. Let me know that you're here. Say hi. So yeah, that's kind of my story there in a 30-minute nutshell. I want to encourage people um, to have your preventative testing, have your colonoscopies, have your mammograms, have your physicals, your labs, have all that stuff done. Prevention is key. Um, Sometimes we find things and we can't prevent them, and we just have to deal with them. Um, but always try to stay positive, try to keep a sense of humor about things. Um, I know that I've struggled with that throughout this, but then I also have to just laugh, because if you don't laugh, you're just going to cry about it, and that's not going to do any good. So always advocate for yourself, um, even if that's not your character. I know I'm of the generation where whatever the doctor says goes, and I've had to learn to speak up for myself. And I've worked in healthcare, the administrative side for most of my 40-year career, so I know how it works. I know you're bound by insurance. I know you're bound by, scheduling surgery times and OR rooms, and I know how all of it works. So I understand where the doctors come from, but I also understand as a patient where it comes from. And when I say that, I mean the anxiety, the unknown, the what ifs. And sometimes you just, it's okay to question your doctor. It's okay to disagree with your doctor. It's okay to get a second opinion. It's okay to get a third opinion. I'm fortunate enough that I have been in the medical field, that I have some good relationships with different physicians and nurses that, are my friends, that I'm able to run things by and, make sure that I'm making the best decision for me. I know some people don't have that, and so that's why I encourage you to ask for help. If it doesn't feel right, or if it doesn't feel right, trust your gut, but, listen to your doctor, but Doesn't mean you always have to agree with them, I guess is what I'm saying. But please, 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 please get your screening. And I know that for colonoscopies, I think at the time that I had colon cancer, it was 50. And so there's, like I said, there's no way, no way, no way. There's no way. You're too young. You're too young. And, there's no family history. There's no this. Like, well, it's got to start somewhere. And unfortunately, at 41, I was diagnosed with stage 3. Now, that means for my children that they have to be screened 10 years prior, so in their 30s, which I know my 2 older sons haven't gotten theirs yet, which I'll get on them about that. I think now the age for colonoscopies has dropped to 45, but I encourage everyone to get the colonoscopies, get your mammograms, and then I hear it so often, oh, it's going to hurt, it's going to hurt. Well, a double mastectomy hurts a whole hell of a lot more than a mammogram. So I don't want to hear it's going to hurt, it's going to hurt. Get your damn mammograms. It takes 15 minutes and then you're done. Whereas, as I said, a double mastectomy is brutal, brutal, brutal. So anyway, I'm going to continue to post shorts and funnies. Due to my neck and paralysis, I'm not going to say paralysis, nerve damage, because I'm not paralyzed. I had a lot of nerve damage. But due to that, it's hard for me to walk without assistance or go outside alone. So I'll try to post some more funnies, do some more lives. And if you're not subbed up, I appreciate it. If you would sub up to my channel, give me a like, comment, go check out my other videos. And I appreciate everyone being here. And just drop me a comment. Let me know you're here. I don't see anything down here yet. But with that, I appreciate everybody being here. And I will check in later this weekend, hopefully. I do have on my links on my page, I do have a GoFundMe, but I don't want people to do that. So forget I said that. But yeah, I hope everyone has a good weekend. Stay positive. Find something to laugh at. Find someone to laugh with. And hope to see everybody out on these YouTube streets. And until then, have a good weekend. Bye, guys.